Jennifer Pulapaka with Podiatry Doc Talk. Regain your health with quick and ingenious tips and chats so you can be stronger and healthier. I'm here, making complex foot and ankle problems sensible and simple. Episode 4, Annual Foot Screens. So what are these annual foot screens? Well, this is the history and physical portion of your feet. It's a comprehensive exam in which your doctor and their team overhaul your chart. They check for insurance and Medicare compliance. They perform simple and basic tests on the lower extremity as part of the Lower Extremity Amputation Prevention program. So you might ask, who should have an annual foot screen? Well, these should be performed on patients with at least one of these factors. Should be every diabetic, every patient over 60 years old, current or former smokers over 50 years old, if you've had a history of a foot or leg ulceration, if you have a history of heart attack, stroke, TIAs, peripheral vascular disease, if you have a history of vascular surgery, angioplasty, open heart surgery, if you have a history of neuropathy, Hansen's disease, spinal trauma, polio, or if you have a loss to the motor function of the legs. And why do it? Well, because it's simple. A comprehensive program follows guidelines, usually adopted by the U.S. Department of Health and Human Services. This will dramatically help to reduce the amount of lower extremity amputations that individuals suffer from. A big factor is the loss of sensation. That can lead to breakdown in the feet, which can result in wounds and eventually the amputations. So foot screens help to document and qualify criteria which makes patients medically necessary for programs such as Medicare's diabetic shoe program or maintenance of mycotic nails with calluses. These are all important. These are what help keep happy, healthy feet. When you come into the office, be prepared for your exam. You need your current and complete medical history, not just about your feet or your legs. I want to know about your hospitalizations or your surgeries in the last year, your current medications, the names of all the doctors, including the specialists that work with treating your legs for wounds, trauma, nails, or shoes. Also, we want to know the approximate dates of things like your pneumonia vaccination, influenza, and tetanus. During this exam, report any significant changes that have happened throughout the year. Arrive unrushed, dress comfortably, and don't smoke for at least 2 hours prior to the screening. If you're a diabetic, we want to know the name of the doctor that's treating you for your diabetes and the date of that last visit. Also, bring the information like your A1C or your last blood sugar check at home. Finally, let us know the approximate date of your last diabetic retinal exam. Usually, an ABI, which is an ankle brachial index, will be performed at the same time. This test is simple, reliable, and safe. The ABI test is usually the first way that patients are diagnosed with peripheral vascular disease who have active symptoms such as discomfort, numbness, non-healing sores. The ABI is also used to look for PAD in patients who don't have any symptoms, but they are vulnerable from this disease due to other risk factors. Studies have shown that an ABI can identify 90% of women who are asymptomatic for peripheral arterial disease. So sign up now for your annual foot screen. Don't forget to include that ABI. We want to keep your feet happy and healthy.